Hello everybody and welcome to April's team brief. So we've had an interesting session this lunchtime. We talked about how well we've done this year financially, and we've done very well. And Simon Marshall described that in some detail and then went on to describe what the context is as we move into the next financial year and how we're going to work very much in partnership with our colleagues across North West Surrey. So then we went on to talk about the Surrey Heartlands Sustainability and Transformation Plan. Now you'll have already heard some of this, and Valerie Bartlett's leading on that work and gave an update to the team and really fleshed out what it might mean for us going forward. And we also heard from clinical colleagues Paul Crawshaw and David Fluck around what their experience of a recent Surrey Heartlands STP workshop was, and actually how confident they felt in the plans going forward. Giselle Rothwell asked us all to think about sharing our good news stories. We want to publicise the great things you do, and so please do send your news stories to Giselle and her team so that we can share them across the organisation and beyond. And finally, Louise Mackenzie, our Director of Workforce, took us through our new leadership and talent management strategy. Now, this is a really important initiative that's really going to help us come together as an organisation and improve the experience that all of you have of working here, as well as giving you the opportunity to build skills and competencies and talent around that area. So Louise will take us through what that looks like, but more importantly, we'd like to hear from you what your thoughts are for implementing that strategy.
Good afternoon, everyone. My name's Simon Marshall. I'm Director of Finance and Information for the Trust. Today at Team Brief, we were talking about our fabulous financial results for the last year. In particular, we exceeded our initial plans and delivered a really small surplus for the year, which in the context of the rest of the NHS at the moment is a fabulous result. In delivering our plans, we were able to see a lot of benefits across the Trust, particularly in terms of staffing. We employed about 129 extra people over the year. We also invested significantly in our estates and our equipment and our IT. But clearly, some of the things we were talking about at Team Brief was how do we meet our current challenges, particularly for how busy we are across the Trust and how much work we're increasingly having to do, how we meet the challenges of securing ever higher levels of staff, and really trying to signal a different approach for the Trust in future, and trying to make sure that we do, I guess, the right levels of work across the Trust, and where it's possible to reduce some of the pressures upon us. So in conclusion then, I'd like to express my thanks to everyone across the Trust who contributed to such a successful year, and look forward to doing equally well in the year coming.
Hello, my name's David Fluck and I'm the Medical Director at Ashford and St Peter's Hospital. Last month we spoke to you about the Sustainable Transformation Programme and the opportunities that this presents to us. And today at Team Brief, myself and Paul Crawshaw fed back about a fantastic meeting we'd had. It was the first workshop in the Sustainable Transformation Programme, and this was a fantastic event. It had people from all parts of the health delivery community and the health receiving community. So it had patients, it had people who were supporting patients in the community, such as Age Concern, it had community and social care, and it had secondary care, such as our hospital. And what we started off with was having a fantastic talk by a gentleman called Muir Gray. And what he described was the various circles of care that there are. So we need to encourage people to look after themselves better, to look after their health, to take exercise, to seek advice when they need it. We need to have the community supporting people, so voluntary sector is extremely important. Family members are very important in looking after people. And then we need to use primary and secondary care more effectively. Particularly in secondary care, what we have to do is we have to make sure we use the valuable resources that we've got to treat patients in the best way. Make sure we are treating the right people and doing that right care consistently and without variability. And overall, the meeting was incredibly well received by all the people there. And I think, putting it together, it feels very different. And I think it's very important that we do engage in this so we can actually continue to deliver great care to our community, but also face the challenge of the financial environment that we live in at the moment, and make sure that when we deliver care, we deliver great value to the population.
Now, one of the things I'd like to ask all of you to think about is sharing your good news stories with us. I know very well that many of you are doing fantastic work, delivering innovative service solutions, giving great experience and care to patients, or indeed undertaking academic work or research and being published. But I also know we don't hear about it all, and I'd be really keen to hear your good news stories and support you in celebrating your fantastic achievements. So if you've got a story to tell, a publication to share, please do let us know so that we can share them across the organisation and beyond.
Hi, my name's Louise McKenzie, the Director of Workforce Transformation. Today at Team Brief I presented the leadership, management and talent strategy for the organisation. So the vision for our strategy is to develop leaders who can enable staff to be the best version of themselves at work. So really strong vision statement for us. And what we wanted to do was to develop a strategy that then set out what we thought were consistent leadership behaviours that we'd be looking for in the organisation, and the different interventions and training courses that people could access in order for them to be able to develop those skills. So we've also heard in our staff survey over the last few years that staff don't always feel supported. They don't always feel that the experience that they get from their line managers and their leaders is fair or effective. And we also hear that frequently leaders and managers feel ill-prepared for the task of leading in the organisation. We also looked externally at research from things like the NHS 5-year forward view, which talks about radical change needed in healthcare models and the leadership support that we need to give the NHS leaders to be able to put in place those different models of care. We also remember the Rose Review, which is Michael Rose looking at leadership capacity in the NHS. And again, with a view around we don't do enough to make sure that our clinicians that are coming through the ranks have the appropriate leadership skills to be able to do those jobs as leaders, and not just the technical skills that they have as good clinicians. And so from our research and from what staff have told us through the staff survey, but also in terms of that vision that I described about supporting staff to be the best version of themselves at work, we want to build our leadership talent in order to really foster improvement and innovation at Ashford and St Peters. There's a real emphasis around leaders collaborating, so around collective leadership, and around how leaders can forge new multi-professional relationships and empower change across what we see at the moment as silos. Ultimately, we're looking to develop consistent leadership behaviours which nurture the right culture for Ashford and St Peters. So the strategy also describes what we'll be offering to staff in terms of management and leadership development. We're introducing a new managers induction programme, which is really exciting in terms of being able to, as a new manager, understand what the role of a manager is, develop your own network, but also understand what training is accessible to you in terms of developing those skills. That will lead you into a core people management programme and an extension of the old managers toolkit. So we'll be doing skills development around how you line manage your staff and developing the skills for you to be able to do that. The strategy also describes other leadership interventions, such as developing a leadership forum for the organisation, where we will hope to bring inspirational speakers to talk about leadership and how it works in other organisations, as well as describing the both bespoke programmes that we'll be developing internally, but also some of the external programmes that you can access, such as the Healthcare Academy programmes, the King's Fund programmes, and the work that we'll be doing with the IHI. You'll be able to access more information about the leadership and management interventions if you go on to the intranet page and look at SkillsNet on the Leadership and Management Framework page. So there's a significant amount of information already on that, and we hope to have fully populated that framework with links to all of the relevant training interventions by the summer.